Hi, good morning. Dr. Pramod Sudarshan here, Senior Consultant Spine Surgeon at Apollo Hospitals, Bangalore Road, Bangalore. Have you seen any child with an uneven shoulder or a prominent rib hump over the back or a visible deformity over the back? That is called as scoliosis. Scoliosis is a condition where the spine curves more than 10 degrees to the sides, and it can progress over the years as the child grows. The primary reason for the scoliosis is called as idiopathic, and usually it happens in the adolescence when the child hits puberty, and it is very common in girls compared to boys. It can also happen in congenital causes where the child is born with scoliosis because of some additional bone or additional vertebra in the spine, or it can be associated with a neuromuscular condition where the nerves and the muscles are weak and it is pushing the spine to the side. So we see scoliosis quite often, and scoliosis can be assessed by a simple test called as Adams forward bending test. When we ask the child to bend forwards, you actually see a visible prominent rib hump over the back, and that varies between mild, moderate and severe degrees of scoliosis. So once we do an X-ray of the spine, we know that we assess by using a term called as Cobb's angle. We measure the degrees of scoliosis, and usually 10 degrees is defined as scoliosis. Up to 25 degrees we can just observe the child. 25 to 40 degrees we can use bracing. We can customize the brace and give the child a brace which will help for the scoliosis. And if it's more than 40 degrees, we need to consider surgery. And usually when we see children from Africa or other countries, they are neglected often, and they come to us when they reach the stage of 80, 90 or 100 degrees when the curve is very rigid. And these surgeries are done at very high specialized centers by specialized scoliosis surgeons, and we need different equipment, specialized OT requirements, especially in terms of neuromonitoring to prevent the neurological deficits to happen. And the surgery, once we do the surgical correction, helps to improve the breathing function of the child. It helps to prevent pain from the deformity, and it also helps to prevent progression of the deformity, and it gives very good outcomes, and the child can lead a normal life going forwards. Thank you.